I am Dr. Jenny Abercrombie, and I wanted to talk to you today about what is root cause medicine. What does it really mean when we say root cause medicine? Root cause means that we are looking deeper at what is triggering and instigating the dysfunction of your body. So, how does root cause medicine compare to the disease based model? In a disease based healthcare model, we are using treatments, medications, surgery to remove the disease and suppress the disease pathway. In a root cause model, we are looking at using treatments to remove the roadblocks that are blocking the ability of your body to function, addressing the triggers that drive disease and dysfunction, and establishing the habits that generate the long term sustainable results. Now, sometimes we need the palliative suppressive therapeutics to control a disease process, but we want to be very conscious of how we use those therapeutics. We want to use them as needed to protect the body, but not just only rely on them and continue to address the root cause triggers, even when you're feeling better after taking the said medication or surgery or herb. But if you never address the root cause, the disease process continues to progress forward, and then you need more suppressive therapy down the road. So, for example, thyroid medication. Thyroid medication is very necessary when you are hypothyroid. You need to bring your thyroid hormone levels up to a therapeutic level so that because it affects your hormone balance, it affects your digestion, your immune system, cardiovascular system. So it can be harmful to your body to not have adequate thyroid hormones floating around the body. But we also want to know, okay, so we're giving this exogenous thyroid medication, but let's also address why the thyroid got dysfunctional in the first place. Why did it go awry? So some of the areas that we want to look at under the hood when it comes to identifying the root cause, looking at what made your body go awry, we get into genetics and epigenetics, which is how your genetics are functioning. Are they turned on? Are they turned off? And we can actually play with how your genes are turned on and off by working on the load on the genetic pathways. Looking into the biochemistry pathways inside your cells, how your cells turning over energy. How are they using the Krebs cycle? How are they doing their methylation? Looking at the balance of your immune system, your nutrition and diet. As Hippocrates said, food is medicine. Looking at the nutrients. What nutrients do your cells need? What nutrients are you absorbing or maybe not absorbing? Looking at your environmental toxic load. So looking maybe mold, pesticides, gasolines, heavy metals, plastics, what's in your drinking water. And also this includes chronic infections, Lyme, chronic viral infections we tend to see a lot of, unfortunately. And then, of course, your detoxification capability, where our bodies are constantly under a load of toxins, and we need to be able to make sure that we can get them out so that the toxins don't disrupt our cellular functions. It can have deeper ramifications into the systems. Of course, looking at your digestion, your stress and nervous system tone, your circadian cycle, your hormonal balance, your mental, emotional, and spiritual balance, your lifestyle and habits, and of course, exercise and movement. So I'm going to share a screen with you for a minute to also kind of help convey what it means to really have a root cause medicine approach in this new aligned healthcare model versus a traditional model. So in the traditional model, they're going to be really focusing more on treating the symptoms. And the root cause aligned healthcare model, we're going to be focusing on what is the cause, on prevention, and improving the performance of your body and the cells. Traditional model will look at using drugs, surgery. You can even say that we can be using herbs in a more suppressive pathway, versus the aligned root cause model. We're going to be using more lifestyle changes, diet, cellular healing, detoxification. Unfortunately, our healthcare system has felt a lot more like a one size fits all, and really it needs to be a customized and personalized approach. The traditional model can feel very reactive and reductionistic, and we really want to move into a space where we're focusing on proactive and holistic modalities. The traditional model really will emphasize more of just your genetic predispositions, but we can do epigenetic control. We can control all your genes flipped on or they flipped off. And the traditional model is extremely expensive and financially draining, especially when you get to those disease states, whereas the aligned root cause model is going to be more affordable and saves money in the long term because we're focusing on preventing that disease state from activating. So when it comes to addressing the root cause model, it really is an orchestra between all the systems in your body. We treat the whole. It's a dynamic interplay between your genetics, your cells, your organ systems, your lifestyle, your mindset. And so it's not as linear as a lot of people tend to think. We really want to take a broader, dynamic approach to our body. And healing requires change. You have to change what you're doing for your body to change the direction it's headed. So let's talk about some common misconceptions. Time frame. So generally speaking, it takes twice as long to reverse a disease as it took to develop the disease in the first place. If we're using a Band-Aid approach where you just take a pill and it fixes the issue quickly. So for example, antibiotics, thyroid medication, hypertension meds. But when you address the root cause, it takes work, time, commitment, and it's not going to feel as immediate as that magic solution pill. Another common misconception is that I went on X medication and it immediately fixed my symptoms. And I expect to be able to immediately go off this medication by treating the root cause. This can be true, but more commonly, with the more underlying dysfunction there is and the more systems that are out of balance that we have to realign and treat, the more time and commitment that is required to fix the root cause. Another common misconception is I can just push my body and go, go, go. You have to move at the pace of your body. You can't push it faster than it can go, and you have to learn to listen to your body. Another one is, so why would you want to even consider looking at the root cause if you're feeling fine? You know, there could be more going on under the hood in your body than you aren't symptomatic for yet. So for example, what is one of the first signs of cardiovascular disease? It could be a heart attack or a stroke. What is the first sign of cancer? It's a diagnosed tumor. Let me share one other slide here. We want to keep patients out of the symptoms and the severe category of this pyramid, right? We have the severe state, your body is in a state of disease. Right above that, you'll have the symptoms. Above that, you're going to actually be preventing the dysfunction and preventing the progression of the symptoms. And ideally, we want to get you into your peak state where you are living your optimal life, where you feel great. We want to keep you out of the disease state, feeling the symptoms, just the reductionistic approach, just make me feel better, doc, with that magic pill. I wish there was a magic pill that could get us up to the peak optimal state, but the reality is it takes a lot of work to get there, and we have to address all of those different root cause layers that are preventing our body, that are roadblocks from getting up to that. So we do our deepest work when you're actually feeling the best, right? When you actually feel like you don't need to go into the doctor, that's when we do our deepest work. Otherwise, if you're just coming in when you have the symptoms, we're still only working in this bottom of this pyramid where we're just trying to relieve the symptoms and treat the disease, which is going to require more invasive, high-intensive therapeutics because the disease process is further progressed. A common question I get is, why did my thyroid become dysfunctional now? Or why did my symptoms trigger now? In order for the body to trigger the symptoms, it takes a perfect storm. And usually it's a variety of those root cause layers. It's an interplay of all the different systems in your body. Your body is amazing at adapting to stressors until it gets overwhelmed, and then it can't handle the dysfunction anymore, which is when you see the symptoms come up. So it's like a bucket that can only handle so much liquid before it overflows. So our goal is to improve that overwhelm, take off those stressors from your body so that that dysfunction doesn't keep progressing, and you never get that overflow to look to the bucket. And lastly, probably one of the more common misconceptions is, hey, this is really expensive. So the upfront cost can feel higher in the beginning of a root cause aligned model, but is cheaper over time by saving you the cost of disease later in life. And it is not just the financial cost of disease, but also the non-tangible cost of disease, the time off of work, the missed vacations, not feeling your best to do what you love, not being able to connect as deeply within your community or your family, and ultimately affecting your ability to live your best life and one of fulfillment. Disease holds you back, and we want to prevent you from your body expressing those symptoms and disease well before you see the symptoms. We want to keep you in that peak optimal state. A couple other notes is to help you really understand why the root cause aligned medical approach is so much different than the traditional approach is, let's talk about labs for an instance. And why would you even consider running more functional labs that don't get covered by insurance? So labs, we can use them to diagnose pathology, which is a disease state, which is more or less what more conventional labs are running. Or you can look at labs to diagnose dysfunction, so a pre-disease state. And to look for dysfunction, that's what we want to look for in addition to the pathology. But if we can isolate and identify that dysfunction now, then we can address it before the disease and the symptoms present down the road, keeping you moving toward that peak state. Now, one common misconception that I get a lot is very polarized thinking that like, okay, herbs, natural, that's not going to suppress, medication suppresses. That's actually very incorrect. We can use medications and herbs to both suppress, but you can also use both medications and herbs to address the dysfunction and to heal and to realign the body. So it really comes down to how you use them and knowing how you are using those therapeutic agents. And sometimes you need to have a suppressive therapeutic agent in there to help to control, maybe we're controlling the replication of a chronic viral infection like Epstein-Barr, or we are trying to control the inflammatory attack of the immune system in a multiple sclerosis patient. And so sometimes you need that suppressive agent to be able to make it so the body can actually expend energy and on healing. So and that suppressive therapy can also buy your body the time that will allow you to focus on addressing those root cause triggers that activate and drive the dysfunction or the disease process. So we really want to bring in awareness to how we are addressing our patients, to how we are using our therapeutic agents. So at the end of the day, I hope this video really helps you understand deeply the difference with the root cause aligned approach versus the traditional model. And at the end of the day, it's really a fully integrated view of how things work in the body so that we can get you into that peak optimal state out of a place of disease, out of a place of dysfunction, so you can be living the best life for yourself. All right, you have a wonderful day.